tend to think of climate change as rising seas, heat waves, air pollution, but there's a quieter crisis that is going on, and that's inside our bodies. Hello, I'm Dawar Butt, your host to Front Seat to Climate Change. This week, we're talking about something that few people talk in relation to climate change, and that's the chemicals and hormones inside our body. From puberty to pregnancy, hormones guide everything: development, fertility, health. But now that extreme heat, toxic air, fossil fuel driven air pollution is impacting them, we're starting to feel the consequences. How does air pollution from fossil fuel actually cause a lot of these changes, lead to bodily harm, bodily damage inside? Well, the answer lies in endocrine disrupting chemicals, or for short, EDCs. These toxins are released from industrial activity, massive commercial agriculture, and traffic emissions. They act like fake hormones, mimicking estrogen, testosterone, or interfering with the thyroid function. And they're basically everywhere in our air, in our water, even in breast milk now. Exposure to these chemicals has been linked to early puberty, declining fertility rates among men and women, and even early menopause. A study conducted in the United States focusing on a sample of 31,000 women showed that the menopause years were occurring on an average 1.9 to 3.8 years earlier. In cities with bad air quality, EDCs have been linked to higher percentage rates and reduced chances of success of IVF. Even conception rates are dropping in polluted areas. This isn't just about long-term risk anymore, it's already happening. To understand these risks in more detail, we will talk to Dr. Nadeem Zuberi, who is Vice Chair Clinical and Associate Professor for Department of Obstetrics and Gynecology at the Aga Khan Hospital. So as we know that air pollution, which Pakistan right now is ranked as the third most polluted, and in previous years it has been ranked as the second or the first most polluted country, particularly from the angle of particulate matter. But at the same time, we know that there are other harmful substances coming out of air pollution, and the combustion of fossil fuel in particular is responsible for these gases and sort of particulate. Now, each of these chemicals has deep impacts on our health. And to discuss that, we're talking to Dr. Zuberi. So, Dr. Zuberi, number one, we know that air pollution in particular has been consistently ranked as one of the causes of impacting fertility. And while Pakistan has a high fertility rate in the region, it has a growing population. But we have evidence from the global north, particularly Europe and North America, how fertility rates are impacted. So, what are the key concerns in regards to fertility for both men and women?
Thank you, Dawar. The problem here, what we are talking about is regarding the fuel burning, which is affecting primarily it is the particulate matters, which are 2.5 sort of like ozones and other chemicals. They are basically endocrine disruptors, and they create a confusion with the hormones. The hormones are the signals, while these particles play as distractors and disrupt the system, and thereby leading to different hormonal actions being halted, stopped, or modified. And in men, it has been shown that it affects significantly in terms of their sperm counts, their DNA fragmentations, and it tends to lower the sperm count also. While in case of women, it largely affects these PM 2.5s. They all of them affect the ovarian hormones. One of the very basic one is anti-Mullerian hormone, which is also known as AMH. Its effectiveness goes down, and when its effectiveness goes down, this means the eggs in the ovary have reduced significantly, and the functioning of the hormones is modified a lot, and thereby resulting into a decreased chances of pregnancy. So it severely impacts in terms of the male partner as well as the female partner, both of them. So even the menstrual cycles are affected. Their hormonal imbalances lead to either very prolonged menses and or very short menses duration. And whenever the cycle is disrupted, whether it's a long or short, fertility gets impacted in terms of itself being not ovulating, which we in medical terms we call ovulating. Basic the eggs when it is released every month in a menstrual cycle, which increases the chances of pregnancy, its release gets affected. So no matter they are trying to have a baby, it becomes very difficult with an irregular cycle or a heavy cycle or a prolonged cycle.
Now that you touched on the subject of particularly how menstrual cycle and women's reproductive health is being impacted. In case of Pakistan, the two things that we routinely see now are extreme temperatures, particularly in the plain central parts and the south of the country, but also in urban areas, we see very high levels of pollution in the winter months. So not just summers anymore, we have one type of impact in the summer and then a different type of impact in winter. So virtually the reproductive cycle is being impacted in one way or the other throughout the year. Now, what are the key concerns for example, people who are trying to conceive a child, or if they're already a woman is already pregnant? What are the impacts that are for vulnerable women? What can we really do to more create more awareness, but also highlight that these are vulnerabilities that we really need to deal with?
You very rightly said that the extreme of temperatures are primarily affecting it. Like a temperature less than 15 degrees centigrade and or more than 30 degrees centigrade will affect the chances of getting somebody pregnant, even because this is affecting the hormonal level at a very, very basic level. So if we take a look at the chances of what will happen if somebody is already pregnant, so her risk of miscarriage will substantially go high. They tend to have preterm deliveries, which is like significantly higher in this group. Their chances of developing diabetes go higher. Their chances of developing hypertension during pregnancy goes higher, and which is not a small fold. It is a significant increase in that. Like even like about 6% to 14% increase the risk is associated in the literature on that. Furthermore, their serious maternal morbidities, they tend to be increase a lot. It is even seen in literature that about 2.5-fold increase can occur in the serious morbidities in women in the extreme of temperature. And also it is basically is the variation in temperature that is more affected. A constant temperature may not give that harm. It's a fluctuation in the temperatures, like temperature going high and then temperature coming down, affects significantly, whether it's on a lower extreme or in a higher extreme. And in terms of vulnerability, this is more seen in areas which are low socioeconomical communities. And in African and other countries, it has been seen the people of color are more sort of affected by this, and to the gender minorities also. So here, what we need to highlight is the temperature, which is fluctuant on extremes, will affect risk of miscarriage, significantly increasing it, preterm birth, hypertension, and diabetes during pregnancy. Furthermore, in areas where smog is an issue, like in Punjab, where the crops are being burned, and across the border and on this side, it significantly reduce the chances of a healthier outcome in terms of, again, the preterm birth and hypertension, and all these morbidities go significantly higher.
So the subject of, for example, gestational diabetes, now from the lens of our country, we have limited evidence. And while international databases say that Pakistan is the number one country in terms of diabetes prevalence, but the link towards climate and heat, pollution, all of it is in a way common sense that when it's hot or when it's polluted, you reduce your activity, and the lack of activity then also leads to diabetes. But the gestational diabetes, that link isn't as well understood. So what can we really do to really make people understand this, that it's climate as well? From the top of my mind, or at least anecdotally, we are hearing more about these cases as well, that a lot of people, women who are pregnant, they are reporting that they're suffering from gestational diabetes as well. And in a lot of cases, they also just simply say it's hormones, but they're completely not linking it with the climate impacts as well. So can you, explain it in a little bit more depth? What
Sure.
are we really experiencing, and how to make people more aware of it?
Okay, so first of all, the South Asians is the one of the very big group of people, including us, where the gestational diabetes, like pregnancy, happening during pregnancy, is significantly higher. And it is seen that the particulate matters, which are like 2.5, they are the basic benchmarks, particulate matters. What they do is they causes oxidative stress in the body. Also, they causes damage to the blood vessels, and also they affect the hormonal profile also. So by doing that, they increase the susceptibility of developing diabetes in these women, and which is not a little bit. This is like 16 to 22% sort of affecting the blood pressures. And for alone diabetes, about 6 to 28% sort of it's a big variability, but it's a big jump. And largely it is because we are prone to it, number one. Number two, all these particulate matter which are there, they causes that oxidative stress as well as damaging the vessels as well as the hormones, which leads to this increase in the diabetes as such. And for this, uh, the usual way of doing it is to do a challenge test or a tolerance test. Like these women are given a glucose sort of a packet to drink on, and then glucose levels are checked. And if these levels are higher into certain categories, then they are declared as gestational diabetic, and very good diet control and sometimes medications need to be used for them to have a better outcome. And in low resource, it becomes a little tricky. But over the years, what has happened is that initially the insulin was the prime thing that was used for diabetes control. And the oral medications were considered as harmful. But in number of years from now, and the data is available from Africa and low socioeconomic countries, that oral medications are very effective. So in last 10 years, use of oral medications or simple medications like metformin or something, these are being used to control the diabetes in these women. So idea remains that if the temperature for various reasons and the environment for various reasons is controlled to a certain degree, these outcomes can be changed. And people have demonstrated that taking actions, and we'll come to that also in a while, but all these actions taken will improve the outcome also.
Slightly, I think, related and also linked question is the environment, or at least toxins in the environment, impacting gender ratios, sex ratios that are part of the population overall demographics? This is a question I think a lot of people are curious about. That can climate environment impact this as well, and or are we seeing any observations in this regard?
It's a very interesting question, and there is some truth. It is not that it is not, the truth is there in that. One may can say it does not affect a great degree, but yes. Reason being, the evidence which is now coming up in changing the sex ratios is largely because number one, the sperms of a man are highly vulnerable to certain chemicals like dioxins. And what they do is they affect the Y chromosome in the chromosome section. Like every man has a XY chromosome and females have XX chromosomes. So Y is a very vulnerable, and we think that men are more macho and their resilience is more, but it's the reverse sort of a XY chromosomes, like women are more resilient, and Y chromosome is not that resilient, and it significantly gets disrupted, and this increases the vulnerability. Also, the male children's health-wise, they also have more issues as compared to a female child. So it has been seen like 12 to 15% shift can occur in severe climate areas in sort of directing males to have lesser ones and female children more. And this effect has been even seen in Pakistan, like in studies have been done in Lahore and these areas also in West also, where smog is there. The smog is rather more associated with this kind of a shift, but high temperature affects the Y chromosome and thereby increases the risk of miscarriage among the male children, and thereby creating a tilt towards higher female ratio and male ratio. So it is there.
And now that we have this evidence also coming out regarding the male and female genders, we do know that Pakistan does have gender minorities, particularly transgender community as well. And while the accessibility to medical facilities is quite normal for female and males, air pollution and heat impact are also impacting these gender minorities. Uh, do you see that we are appropriately responding to that as well, or there needs to be a better, more inclusive response, and also making sure that gender becomes a topic when discussing climate and impacts on overall health and reproductive health, particularly?
Well, if we take this perspective, then probably not more than 12% of the countries across the globe do have any kind of a policy towards that, and remaining don't have. And these are the very, very few countries which do have certain policies in this context. Rest don't. We don't see uh, a policy coming in at this point in time in our country, but there is a scope for that. The other part that is happening is that uh, the impact largely is because of one or two things. One is that while they are their requirements is very mixed and variable, all those medications they are taking or the support, mental support they are getting gets disrupted a lot. So the storage becomes one of the major problem. Is that like the kind of a medications they are on will become difficult for access as well as storage wise also. And whenever such a event happens, like temperature variability and lead to a disaster situations, uh, their anxiety levels are even higher, and not getting a proper support is that one of the two factors which affect significantly in this. So in this context, if something that need to be done is the availability of the uh, medications and the social structure in terms of mental health support are the two things that people need to work on and take this agenda forward for these group of people who need special attention in this context. And probably we can learn those messages from those 12% countries which have policies. One can adapt or adopt with modifications which can be more meaningful for our setup. This can be done.
Crisis is changing our biology, and public health, reproductive health must become part of our climate response as well. Overall policy, I think, and Pakistan still has not been able to make the link between climate change, environmental pollution, and overall health impacts. And then, of course, reproductive health is a very specific subject in it as well. And we still struggle to have an open conversation, or at least medical practitioners are not fully informing the public as well. But at the same time, there's this huge gap in policy as well. And I think medical practitioners depend on guidance from policymakers itself themselves. So policymakers, what can they do to ensure that, for example, a couple that is planning to have a child, they can possibly give them awareness and advice on what to do in case of high temperatures or a polluted environment. If, for example, you're in Lahore, are the doctors advising women to wear masks when they're expecting a child? So these sort of nudges and policy changes are, of course, needed. But do you think that change is happening, or what would be your way to recommend for these changes to happen?
I think the COVID has taught people a lot uh, in terms of policies, the ones who are making the policy and the one who on which the policies are impacted. So the communication has increased over time in that, and I think that should be utilized as the area where one can move on and try to have more patient-friendly policies adopted. Like, uh, but I would say that there are probably three zones on which the policies can work on. One is to have a mitigation of the things which are happening, like efforts to be made where CO2 and all these ozons on PM 2.5s can be reduced. All these actions can be worked towards that. That's a mitigation approach. And then adaptations need to be brought in terms of environment-friendly areas in the healthcare facilities, in the schools, in the public places, and all these places where the women are going for prenatal care. All these, if this can be brought in as adaptive changes, good shelters, that is going to make an impact. And thirdly, kind of a developing resilience in the system. So developing social circumstances where all these can be helped out. Now, how it will happen, probably what will happen is that one need to have more sort of a actions towards reducing the pollution in the sources by strict emission controls, like enforcing regulations where industry and other places can have those policies that they will not emit those chemicals in the area. Plus clean energy shift. So move towards investing into massively into solar and kind of a wind sort of approach, and electronic vehicles will reduce those emissions in the environment. Plus declaring cities green, like vertical gardens. Singapore has adopted that, and initiating like million tree plantations kind of a. So these approaches can have ability to reduce the pollution in the sources, while to protect women and the children, one can move on to developing smog alerts, action plans to see whether sort of an issue for clear warnings are given when these kind of events are happening, or providing masks, simple masks which can be made at home, ensure air purifiers being available in these healthcare facilities at least, uh, beat the heat by providing shelters in the area where the care is being provided for these pregnant women and small children. Uh, Also, strengthening the healthcare system where sort of they integrate the environmental care with the prenatal care. So if they combine this pool together, it is expected that it will reduce significantly the morbidity associated with this climate change which is happening.
Thank you so much, Dr. Nadeem Zuberi. That was very comprehensive, and happy to have you on the show and have your insights on climate change and health. Thank you for joining us. Resilience means a lot more than simply developing new infrastructure. It means using data and evidence to impact policy that isn't going to, in the long run, impact our health, making sure that our health is also resilient. It means making reproductive health climate proof with better monitoring, faster alerts, targeting support for vulnerable groups, and making sure that items like clean water, cooling, and others are accessible to everyone, especially the vulnerable groups. Because the climate crisis is not just a planetary emergency, it's a deeply human one. And its fingerprints are already visible in our hormones, in our health, and our hopes for the future. That's it for this week. Thank you for joining Fancy to Climate Change. I'm your host, Dawar Butt. Catch you next time.